Good morning. It is Tuesday, October the 4th. This is the Multnomah County Board of Commissioners and our Tuesday board briefing. Today's meeting is a hybrid board meeting, so some presenters and guests will appear in person and some will appear virtually. For those who are presenting virtually, please mute your mic when you are not speaking, and when you present, make sure that your mic is unmuted and your camera is on. Today's first presentation is an informational briefing to address an FY23 budget note surrounding the Joint Office of Homeless Services East County Investments. Who is kicking us off? Oh, Shannon, there you are. For some reason, my computer is not working this morning. Oh, there it goes. All right. Good morning, Shannon.
Good morning, Chair. Good morning, Commissioners. Shannon Singleton, my pronouns are she and her, and I'm the Interim Director of the Joint Office of Homeless Services. And I have with me today Joshua Bates and Kanoy Eggleston, who will introduce themselves in just a moment. Next slide, please. Today we'll take you through just a brief context setting, go through our racial equity lens and our geographic equity work, as well as a history of East County investments and outcomes, and then really focus in on the FY23 investments. Next slide, please. A little bit of the context setting. As you all know, we are at the tail end of trying to pull people out once they fall into homelessness. This is to give you a bit of a snapshot of what is happening in our community. This is data for the state of Oregon. You can see in the pie chart, extremely low income renter households. That 28% there, I know the colors are a little bit tough, so I'm going to explain them. The 28% is those who are seniors, and then your other large blue section is the 34%, is those who are actually in the labor force. And I wanted to share a little bit with you all to understand that folks who are extremely low income in our community are those who are food prep workers, restaurant wait staff, cashiers, teachers' assistants, personal care attendants, and agricultural workers. And those who are in our 30 to 50% of area median income are our cooks, our store clerks, our groundkeepers, janitors, retail workers, health aides, and warehouse workers, as well as customer service representatives. This is just to share a bit of a snapshot of who all is being impacted by, in our next chart on to the right, this bar chart with available homes for people with these various incomes. Again, just highlighting our ongoing lack of affordable housing in our community. And then the final pie chart here gives you a snapshot of rent burden. And unsurprisingly, our folks who are in extremely low income, that first group of people I mentioned, are facing rent burden at 87% and severely cost burden at 76%. And those in that second category of very low income are looking at 80% cost burden and 36% who are severely cost burden. Next slide, please. Again, a bit of a snapshot. As you all know, we released some PIT numbers, point-in-time count numbers earlier this summer. We had 5,228 people who experienced homelessness on the night of that count. In addition, this is an updated data piece that I would like to share with you all. We previously have shared the FY21 number, but as of fiscal year 22, we had 6,440 people who accessed homeless services for the first time in 2 years. This is over a 30% increase from the same data point for fiscal year 21. Next slide, please. And with that, I will hand it over to Josh Bates.
All right, good morning, everyone. I'm Joshua Bates. I use he, him, and his pronouns, and I'm the Deputy Director at the Joint Office of Homeless Services. So to begin, I'm going to uplift our values around equity. In addition to equity being a core value of the Joint Office, the Supportive Housing Services measure calls on the county to center Black, Indigenous, Native, Latino, Latina, and Latinx, Asian, Pacific Islanders, and other people of color who are overrepresented in the populations of people experiencing chronic and episodic homelessness. Consistent with the values of the Joint Office, all planning work that we do centers the voices of people with lived experience, especially from these BIPOC communities. Can we go to the next slide, please? Okay, So this slide really provides an overview of geographic equity in East County. And the goal is to increase access to homeless services in East Multnomah County. Historic injustices and racial inequities through eminent domain, redlining, gentrification, and housing exclusions precipitated demographic shifts to the eastern part of Multnomah County, meaning BIPOC individuals are more represented in East County. In terms of engagement, community stakeholders have asked for an increase in resources, an increase in BIPOC and LGBTQIA plus youth investments, and improve access. We've been having ongoing conversations with community stakeholders and elected leadership from East County to ensure that East County needs are represented in our strategies and our approach to working in East County. We also have prioritized geographic equity in the recruitment of the Continuum of Care Board and the Supportive Housing Services Advisory Committee, and also will prioritize geographic equity in the recruitment for the Lived Experience Advisory Committee and the Equity Committee. So what this really means is that the East County stakeholders and voices will be represented across not just our approach when it comes to our work. They will also be represented in our advisory groups. So in terms of systemic barriers, there has been a lack of investment and a lack of infrastructure over time. And this gets us to implementation, where we're going to increase investment, improve access to homeless services, address the racial disparities in access to services, and increase access through BIPOC-led programs. Some of the notable programs include the Youth Opportunity Center, which is the Rockwood Campus Partnership, which includes the Boys and Girls Club, Latino Network, and Open School and New Avenues for youth. There's also PDX Connect, which is a suite of services focused on foster care transition. This disproportionately serves youth living in or from families of origin in East County. The Joint Office of Homeless Services also funds the City of Gresham's Intensive Street engagement, which provides staffing and flexible funds for 2.0 FTE that are homeless services specialists. So really, East County is a core factor in all of our work. We're also trying to make sure to interlace geographic equity into all the different types of work that we do at the Joint Office of Homeless Services. All right, can we go to the next slide? All right, I will pass it over to Kanoy.
Yeah, good morning, Chair and Commissioners. My name is Kanoy Eggleston, and my pronouns are she and hers, and I'm the Director of Programs here at the Joint Office. I'm going to have the next few slides with you all, highlighting an overview of the Joint Office investments in East County, spanning from fiscal years 19 all the way to current. And so this slide indicates investments over time, and as you can see, there's always been investments focused on East County, and there is a notable increase in fiscal year 22, with those investments funded through supportive housing services dollars. And so this line graph will show that progression over time, and in the next few slides I have, we'll look at each of the total amounts per fiscal year. So next slide, please. So this slide represents investments focused on East County during fiscal years 19 and fiscal years 20. As you can see, the total amount of funding is at the top of the slide for both years. In FY19, it was approximately $1.8 million, and in fiscal year 20, approximately $2.3 million. The service categories that we have in these investments are outreach and navigation, shelter, employment programs, and supportive housing. I'd like to provide examples of programming in each of these service categories, as it highlights the vital work of our community and service providers. So when we look at outreach and navigation, the Joint Office during these fiscal years funded East County outreach efforts at JOIN and the City of Gresham. JOIN provided 2 FTE that were housing placement focused outreach workers dedicated to East County, with the goal of moving 30 individuals into housing per year. These outreach workers were really focused in underserved areas of East County where other efforts don't reach. And then there is the City of Gresham's Intensive Street Engagement Program that Josh just spoke about too, that works closely to coordinate with other jurisdictional partners and local service providers to support in the connection of resources, so behavioral health resources, shelter services, housing placement programs, and so on. A couple other exciting programs within the shelter category is with our Portland Homeless Family Solutions. They operate a family shelter, emergency shelter with housing placement resources out in East County. Additionally, we have Human Solutions that operates Gresham Women's Shelter. It's a low barrier shelter for single women with housing placement supports. I think it's always important to highlight the voices of our shelter guests and our shelter providers, so I often like to add a couple quotes through these presentations. So I'd like to note that a shelter guest at Human Solutions noted how much Gresham Women's Shelter has saved me from being homeless. They have provided me with food, a safe place to go, and a starting point, a direction. I am truly humbled writing this because I am feeling grateful for all they have done, not only for me, but for others in the same boat. And then we also have, I'm going to go down to the employment programs. One of the programs I'd like to highlight is our Clean Start program provided through the City of Gresham. It's a team that provides mobile trash pickup in public places. They partner with the Gresham Police Department and the street outreach workers to develop standard trash pickup routes and identify high impact areas. So in FY19, they had an annual goal of 120 locations and surpassed that and cleaned 536 sites. And then lastly, within our supportive housing category, these investments funded Willow Tree, which is it serves homeless families out in Gresham and unincorporated areas of Multnomah County like Troutdale and Fairview. Next slide, please. This slide represents investments focused on East County during fiscal year 21. And so it's the same categories as the previous slide with a total year investment of $2.45 million. And again, I'd like to highlight a couple more programming areas. In outreach and navigation, there were some new investments this fiscal year with Central City Concern and TPI's navigation teams. And so those teams really support in navigating people to other system services like shelter, healthcare, transportation, and housing services. And then also we have within the shelter programs an important one of the important programs I'd like to highlight within Gresham Women's Shelter is housing placement programming. And so we had invested this fiscal year in providing shelter guests with flexible rent assistance for housing related costs. So things like, move-in costs, debt reduction, deposits, and rent assistance. And let's move on to the next slide. So this slide highlights outcomes across the 3 fiscal years that I just spoke about, so FY 19 to 21. Starting from the far left with number of people served through street engagement services within East County, and you can see that increase over the years. And then in the middle, we have number of people sheltered through emergency shelter programs. And what you'll notice is there is a drop in 2020 and 2021, and that had to do with COVID restrictions in our shelter operations. And then on the far right, you'll finally see it's the number of people assisted with housing navigation while in shelter, and that similar drop in 21 is associated with those COVID restrictions that we experienced during that time. Next slide, please.
Okay, so now I'm going to talk about the East County focus in regards to the supportive housing services funds. So the 2020 passage of supportive housing services, the supportive housing services measure, allowed the Joint Office to increase investments across all of our systems. This increase in funds supported people exiting homelessness in East County, and they were specifically a 357% increase in FY22 and a 13% increase in FY23. Additionally, the Joint Office committed to developing a strategy for equitable geographic distribution of services. In FY23, the Joint Office will analyze the geographic distribution of services in Multnomah County. Once the analysis is complete, the Joint Office will create plans to address opportunities for further coordination in Multnomah County. This analysis will start in winter. The teams will work to identify the need in East County, and then we'll conduct an analysis of services provision with an equity lens on geographic services. The analysis will include diving into data disaggregation of programs that serve that area and mapping out next steps for delivering services in a more equitable way. All right, can we go to the next slide? And I will pass it back to you, Kanoy.
Yeah, so this slide represents investments focused on East County during fiscal year '22. The increase in investment from '21, as Josh mentioned, was due to our supportive housing services funding. It's the same service categories as we've had before, and with a total year investment of $11.1 million. So that's a more noticeable increase from the previous fiscal years. If we go down to those service categories of outreach and navigation, there was $995,000 within the programming element there. There was an expansion of existing navigation teams, and it was really to ensure a deeper reach into our community, including dedicated resources out to East County as a service region. This was also in response to a lot of requests our East County city partners in Wood Village, Fairview, and Troutdale had. And with this, currently we have the expanded teams. They're all staffed up and operating. An exciting new provider that we had with this expansion was with the Mental Health and Addiction Association of Oregon to provide focused peer support services throughout the navigation teams. And with these navigation teams, we also continue to partner with the Multnomah County Hope Team to refer services. And when fully staffed, this team provides 23 FTE towards this effort in comparison to FY21, where this team consisted of 5 FTE. And let's go down to the next service component, where there was an $8 million investment in shelter, capital, operations, and programs. There's a few programs I want to highlight here because this was really exciting from last fiscal year. One of the partnerships that I'd like to highlight is with our Metropolitan Public Defenders and the Gresham Women's Shelter's Housing Placement Program. MPD is a barrier mitigation program that supports individuals with attorneys to help identify and remove barriers to success in obtaining permanent housing. The Gresham Women's Shelter's housing placement team noted the value of this resource in helping so many shelter guests who otherwise would have had a very difficult time securing housing. In particular, there was one woman who believed she would not be where she's at today if it wasn't for the housing placement team and with Metropolitan Public Defender support, who supported her in removing some legal barriers to be able to secure a job as a peer wellness support worker. We also had in FY22 the Gresham Adult COVID High Risk Motel Shelter. This was an investment that was focused on purchasing the approximately 50-room Motel 6 in West Gresham off of 185th. That motel is serving highly vulnerable single adults, and the Joint Office utilized our Project Turnkey funding as well as SHS funding to purchase and continue the operations of this motel shelter. Also would like to highlight Rockwood CDC's Motel Shelter for Families, currently in the fiscal year 22, serving 30 families out of the 70 rooms at Rockwood CDC. And then lastly, of course, our severe weather sheltering sites in East County. So in FY22, we had a few locations out in East County that provided shelter, food, and supplies to more than 300 people during severe weather activations during the winter season. Then I'd like to go down to the employment programs, where there were $2.1 million investment. That was a significant investment in our low barrier employment programs. And there's a couple that I'd love to highlight for you all today. One is with Cultivate Initiatives, and they have a workforce cleaning brigade program. It's a workforce program that is composed of neighbors who are currently or formerly houseless that have been recruited either from community partners or word of mouth. Last year in fiscal year 22, they cleared 533,000 pounds of waste and garbage out of public spaces, particularly in areas of visible roadways or businesses out in East County. I think it's really important to once again highlight another story of one of the employment program participants. If you don't mind, I'm going to share Christopher's story with you. Christopher went from not knowing how to start a job to running his own crew as a development lead. Christopher was one of our houseless neighbors in East Portland. Through Cultivate Initiative's workforce program and with the support of SHS employment funds, Chris had the opportunity to make a dignified wage, beautify his community, and engage in meaningful work. Chris describes that he hangs out with friends who are also employed in this program, which provides really needed community support and a sense of belonging when it comes to forming that community for himself. The hope and optimism he now holds is very audible in his voice and as he talks about his involvement with this workforce equity program. All right, we're going to move on to next slide, please. And these are the outcomes. This slide represents the outcomes for FY22. Starting from the left, you can see here there's 254 people that were served through street engagement programming out in East County. In the middle here, you have 272 people sheltered through emergency shelter programs. And on the far right, you have 233 people assisted with housing navigation while in shelter. And you can see that notable increase in shelter and housing navigation from those previous fiscal years. All right, next slide. Now let's go into these last few slides. We'll be looking forward to this fiscal year 23. We have that $1.3 million investment in our outreach and navigation programming. Additionally, there is about a $9.1 million investment in shelter capital, operations, and programs. In addition to some of the services you'll hear Joshua talking about more in these upcoming slides, I'd like to really quickly highlight our Joint Office's shelter development team that is currently working on investigating multiple opportunities for congregate shelter, alternative shelter sites, and safe parking sites out in East Multnomah County for this fiscal year, and that will be brought back to the board here shortly. Oh, and then lastly, I just want to highlight that photo up there. Sorry, that just is a wonderful photo of the Aurora, which is a supportive housing program that'll be set to open out in East County in 2023, working with about 16 families. Next slide, please.
Oh, thank you. This slide also has images. So these images are of some of the amazing work that is being done in East County. It includes medical support and severe weather shelters, trash cleanup, and the mobile shower truck that exists at Cultivate Initiatives. So the severe weather shelter at Cultivate Initiatives is the Sunrise Center. There's multiple severe weather shelters at Cultivate Initiatives. There's the Sunrise Center and at Reynolds High School. They provide shelter and food and supplies to more than 298 people and showers to more than 50 people. We also have partnerships with Our Streets PDX and Greenbridge Coffee. We were also able to create new partnerships with the Mental Health and Addiction Association of Oregon and the Iron Tribe Network, who sent peer support staff out to shelter each day we were open. So when we have a severe weather event, we make sure to try to create strategies and work with local partners across Multnomah County, but especially in East County. Can we go to the next slide, please? All right, this slide does not have any pictures. This is all words this time. But these are East County emergency housing and support services. For shelter, we have the Greater New Hope Family Shelter at Rockwood CDC, and diversion that provides additional family shelter capacity in our system of care. We also have the East County Village, which serves 60 individuals. We also support their operations and development fund. In regards to supportive services and housing, we have domestic violence system investments, which include emergency shelter locations, which we keep confidential because they are in the domestic violence system. In addition, we partner with El Programa Hispano Catalítico, which has offices and services in Gresham, which include rapid rehousing, rent assistance for domestic violence and sexual assault survivors. Additionally, the Homeless Youth Continuum works in East County. New avenues for youth programming exist at 470 Southeast 165th Avenue in Gresham, which provides homeless youth case management and employment services. Additionally, there's NEA, which has some funding that has a focus on East County, specifically for school advocacy programs. Janus Youth Programs also works in East County. Janus has a mobile case management for their Changes and Insights program that provides support for youth that are pregnant and or parenting in East County. Additionally, Outside In we provide funding for work in East County, which provides mobile services to youth residing in East County, which includes assertive engagement, case management, housing navigation, treatment and permanent supportive housing, recovery supported navigation, and community health worker housing stabilization supports. And finally, that we have $750,000 of these funds will be passed through to the City of Gresham for shelter capital at 2 sites. In addition, and through various joint office contracted providers, there'll be additional motel and hotel vouchering to be used in emergency shelter in East County that will be provided. So that's sort of an overview of the different investments and programs that we have been supporting and working with in East County. And I will now go over to the next slide, which is questions. Does anyone have any questions for us?
I'm sure there will be questions and comments. First of all, I just wanted to mention that the Joint Office is working with East County cities to bring forward a similar presentation to their city councils so that they have this information as well. And I know that those haven't been scheduled yet, but will you please let me and Commissioner Stegman know when those get scheduled?
We will certainly do that. Absolutely, Chair.
All right, questions and comments. Shannon, did you have anything to add?
No, I'm just back for questions.
Okay, great. Commissioner Myron, questions or comments?
Yes, thank you. Thank you so much for being here, Joshua, Kanoy, and also Shannon virtually. I appreciate the presentation, and I really appreciate Commissioner Stegman asking for this budget note. Sorry she's not here today and hope she feels better soon. I have a few questions. Going back to the number of people who access homeless services for the first time in 2 years, that's sort of that broad number, the 6440 number. Is that all, are those individuals not repeats and people who have never accessed homeless services before?
Thank you. Thank you for the question, Commissioner. That is, so it's over the 2-year time period, and it is individuals. It is not exclusive, or it does not exclude people who had been homeless before, but they would have been homeless or touching the homeless services system 2 years prior. This is a HUD definition, and it's really about, it includes those who have access for the first time, those who have returned to homeless services, and those who, again, had not been there for about 2 years. I believe our data for returns to homelessness, though, are, sorry, I'm looking at this report quickly. So from our Q4 report, those numbers are about 19.2% or about 1,000 people. So it absolutely is not entirely folks who have been housed and then returned to homelessness.
Awesome. And this is something you can also provide later if you just don't have this at your fingertips, which I would totally understand. But do we have a breakdown of their reasons for accessing homeless services? Like what made them access homeless services, sort of separate those out, and then what happened to them as a result of getting those homeless services?
I don't at my fingertips. You are correct, Commissioner. I will talk with my data team and see what level of disaggregation we can do on that, and get back to all the commissioners via email.
Awesome. And then just a question about engagement with East County in general. And I appreciate you mentioned that there'll be engagement with the councils in various cities, but up till now, over sort of coming up with this plan, what exactly is that engagement with leaders and engagement of consumers looked like?
Thank you for the question, Commissioner. I did neglect to mention I actually have a monthly meeting with the city managers and Commissioner Stegman and some of her team, as well as the HOPE team leads once a month. And I believe those have been happening for at least a year before I got here. So those meetings continue to happen where we both provide updates, but troubleshoot and look at some next steps. And then I would look to Josh if there's any particular updates from the advisory committees and the way that East County is particularly being engaged there.
Well, in both of our recruitments for the Continuum of Care Board, as well as the Supportive Housing Services Advisory Committee, we had a question and an emphasis on geographic equity to make sure that there was representation from across our community, especially with an emphasis on East County. So we have representation from East County on both of our advisory groups, and that will also be replicated in our equity committee as well as our lived experience advisory group. So that's how that is manifesting in the advisory spaces.
So, like, how much representation is on the advisor groups?
I don't have that number in front of me, but I can certainly get that to you, Commissioner.
Okay, that would be great, because I just, in talking with some of the mayor's council members in some of those cities and consumers, we hosted sort of a big convening around behavioral health, and they don't feel that they have been reached out to as people in that community and as the elected leaders. And so there will be another larger convening around this, and so would love to engage with Joint Office and Behavioral Health Division in sort of meeting with those people as well, not just the people on this on our advisory group. So I think there's an opportunity there. In terms of some of the investments you talked about in the shelter and how many people were served, is that when you say, I think it was 672 people, that might have been fiscal year 22, that were sheltered. For how long is that? Like, is that 672 people worth of a year of shelter or a few days, or how does that break down in terms of shelter nights?
So, Commissioner, that is the number of people served, individual, unduplicated through the year. So there's various lengths of stay. We pull average length of stay for shelter at a more aggregate number than just by East County. So it has various lengths of stay for individuals in there, but it's unique individuals served in shelter during that fiscal year.
So the 672, though, is East County.
Correct.
And okay, would we be able to pull out the number of shelter nights in East County that were paid for with that 8 million or whatever number that was?
So the bed night count is something we could do. It's kind of a pretty simple math equation because it's number of beds by number of nights in the year. That's why we don't use it too much any longer for reporting purposes, but I can absolutely do that math and send it back out to you.
Okay, that'd be great. It just, when we say 672 were in shelter, it could be one of them was in shelter for a day, one of them was in shelter for 6 months, and sort of understanding that breakdown. I would just be curious because I think that gives us different information, not only, it adds to the information about how many people are served.
Sorry, Commissioner, can I clarify then? That sounds different. Are you saying you want to know length of stay? Because bed night and length of stay are different data points.
Well, I think they're different but related, so I'd like total bed nights and then maybe average length of stay, I guess. So the number of bed nights per individual would be their length of stay. Is that correct or no?
The bed night count is not a per individual count. It's a count of number of bed nights provided by the shelter. So that's why it's, I don't think the data point that you're actually looking for. So you would multiply 672 by the number of beds in that shelter to get the total number of bed nights by the year. So it's not going to get you what you're looking for. I can get you average length of stay, which is just a different data point than bed nights. So thank you for clarifying.
Okay, thank you for clarifying. And then just one of a question that I had about sort of what we expect. Skip that one. But for Cultivate initiatives and that investment, I've worked closely with them, and that's. I could not support them enough or say enough good things about them. They're fantastic. And I talked to them in terms of the hygiene services, it seems there could be ways to leverage funding with public health as they do hygiene services, and also with the availability of Medicaid funding for housing needs, also, which seems like a great opportunity that will be happening. How have we considered ways to leverage that in terms of, maybe we don't have to do the full $2 million investment through the work, like that there would be ways to sort of braid some of that funding that could be cost effective and efficient. Have you spoken with public health at all about that?
Thank you, Commissioner. We do actually have regular meetings through SHS with multiple county departments and then individually with those departments. I'm not sure if this particular question has been raised about public health dollar leverage, but I can definitely bring it back to our SHS lead, who will continue those meetings with the health department. The other piece around Medicaid, I just want to say thank you for bringing that up. It's really exciting that our Medicaid waiver was approved, and we have many conversations exploring how we can utilize that Medicaid eligibility and funding for housing to support in some sort of bridge or transitional way as we get folks then connected to those long-term vouchers or long-term rent assistance that they need. So definitely more to come, but we've absolutely started those discussions.
Awesome. I have just one last question, and I may have just missed it because I think you did cover this, but just to share, how many FTE are dedicated to East County in the joint office or through the joint office?
Thank you for that question, Commissioner. We did not share a specific FTE. We have 3 FTE dedicated to East County navigation, but many of our other providers like Janice Youth or NAFI are serving throughout the county and have maybe 1 or 2 staff. So the breakdown of FTE gets a little bit complicated. We could definitely share something back that is those who are dedicated, but also would want to continue to contextualize that folks who are receiving funds to serve Multnomah County are expected to serve all of Multnomah County, including East County folks.
Okay. Actually, one very, very last question. And this is what I've heard from a lot of East County residents who may not be in Portland in Gresham. And could you just talk about how you meet the needs and communicate with people in East County beyond East Portland and Gresham, that group that have expressed feeling sort of under acknowledged or underserved? So like the Fairview, Troutdale.
Absolutely, Commissioner. So the city managers of Fairview, Troutdale, and Wood Village are in these monthly meetings that we have with, again, folks from the city of Gresham and Commissioner Stegman. So that's one place that we continue to engage. Commissioner Stegman also has different forums for her geographic region, and we've presented there, engaged directly with neighbors, as well as some providers. That was actually where I got to meet Caleb at Cultivate, who I agree is absolutely amazing. So those are some of the different spaces that we've engaged. And then I think, again, to the chair's point, we'll be presenting in front of their councils as well. And as we recruit for our folks of lived experience advisory body, we will, again, be looking towards some seats specifically for East County to ensure representation.
Thank you. Thank you so much. Appreciate the report.
Commissioner Jayapal.
Thank you, Chair. Thank you so much, Shannon, Joshua, and Kanoy. This is really great, interesting information. Just a couple of questions. One, kind of foundational. Joshua, you mentioned that we're going to do more analysis about geographic equity and distribution of services. I'm curious, do we know now, or is there a way to figure out what portion of our population of folks experiencing homelessness are in East County, or is that just kind of meaningless given that people move around?
Shannon, do you have anything that you would want to uplift before I jump in?
Thank you, Josh. Thank you, Commissioner. I would say generally we have that as a part of the point in time count report, which we will have again this year. But again, we all know that that's a point in time, and I think that you're asking something that's a little deeper than just that one point in time. I think one of the things that's exciting that we're embarking on for this year is we're doing a tri-county point in time count that, again, while it's a snapshot, I think will give us much more understanding of the geographic distribution of folks. I would say from my experience on the ground and running the outreach program that served East County, it is definitely the folks who are outside of city limits that we tend to really focus street outreach on. So lots of folks over in some more wooded areas, for example, feeling a little more rural, a lot more tense, that it definitely just looks different than it does in the city. So not to the degree that we can say on a day-to-day basis, but we do report that in our point in time count full report.
Thank you for that. Yeah, I know it's a complicated question to answer, but in terms of figuring out equity, that feels like one of the data points. And when I look at, I don't know, if I try to do rough math on total SHS revenue and our investments in East County, that's what I'm trying to figure out. Does it seem proportional to the need or not? And it feels like, we're never going to be exactly proportional because there are good reasons not to be, but understanding that would be important. So I'll look forward to that. And then I'm assuming that the dollar numbers here, it's all SHS funding as opposed to anything else. Am I right about that?
Kanoy, do you want to share the different funding sources?
Yeah, so not all of them, right? So pre-fiscal year 22, there's it's an assortment of county general. We also have federal funding, grant funding, Portland general fund. So it's a blend and a mixture of it. And then when FY22 hit, then it was the ramp up and all of that additional, like kind of that increase was primarily SHS.
So, for example, the 12.6 million for FY23 is all funds.
Let me check that out. All of my
Yeah,
notes.
it is. It includes
Is it?
SHS and
Oh, yes, I'm sorry.
prior investments that we made that were from county general fund.
Okay, great. And then
I just want to be clear, though, Kanoy, sorry to clarify, but we do not use any of the City of Portland funds, which makes it in East County, which makes this, yes, adds a level of complication. So, thank you.
got it. Thank you.
Thank you, Portland. I could hear the screaming. You don't need to call me.
And then last question. So when I look at fiscal 23, for example, 12.6 million total, and then 87,000 in supportive housing, that seems really low to me. So I'm curious about does that include rent assistance, or are we not providing long-term rent assistance in East County? Or, when I think about what rent assistance and social sort of supportive services account for in the rest of the system, I'm curious about why it's only 87,000 in East County.
Thank you for that question, Commissioner. That's primarily a bucket that is permanent supportive housing buildings. So it's, for example, the investments that will go into the Aurora. It doesn't necessarily include just long-term rent assistance. So some long-term rent assistance absolutely goes to folks in East County, but not all long-term rent assistance is supportive housing either. Supportive housing includes that really intense wraparound services. So that category we expect to see continue to increase as we're able to put more dollars out the door for supportive housing. So we just on October 30th released a NOFA for providers for supportive housing, and we expect to see some throughout the county, potentially, again, looking at how we score those and bringing a geographic equity lens will be part of that review process. And that will not be our only NOFA around supportive housing. A lot of those dollars are continuing to and will continue to be put out the door.
So just so I understand, yeah, and I get that rent assistance doesn't have to be supportive housing rent assistance, but I think of the SHS dollars as supporting a variety of forms of rent assistance and then also supportive housing services. So, I mean, I don't think there's more to be said. It still seems low to me, but I think I understand what you're saying is that it's ramping up, and perhaps also that there is rent assistance and other housing support money that's not reflected in this 12.6 million that might be going to folks who are living in East County or being housed in East County.
That's correct. There's additional permanent supportive housing dollars going out. I think the other thing to highlight is the outreach and navigation category includes rent assistance dollars as well. So there's rapid rehousing. Some of the agencies have access to HUD and coordinated access and those sorts of vouchers as well as in our shelters. I think Kanoy talked a little bit about some of the different housing out of shelter programs. And so there's rent assistance money in all of these buckets that you see. It's not just in supportive housing.
Okay. That's helpful. If there's anything else that, again, it sounded a little bit like there's other investments that are being made that are not reflected here. So if there is anything else as you think about it that's not reflected in the 12.6, if you would just send an email back out, that would be great.
If I could clarify that, Commissioner, what I'm saying is we have some dollars that were in our budget and allocated for certain categories of programming, but were not programmed for a specific agency. So we're going through NOFA processes this year to put about $15 million out the door, and one of those buckets includes permanent supportive housing.
Okay. All right. Thank you.
Commissioner Vega-Peterson.
Thank you, Chair. Thank you so much, Shannon and Josh and Kanoy. I appreciate the information. It's great to have some time to really focus on East County cities and the investments that are happening there. I guess my first and most basic question is, what is the definition that you're using for East County when you talk about all of these different investments?
Kanoy, do you want to take that one, being closer to the programs?
Well, I would actually, Shannon, do you mind? And then I can kind of think through how we, as far as whether, that would be helpful.
So, and let me just give a little context. I live in East Portland, right?
Yeah.
And so, but sometimes when we talk about East County, we talk about everything from 82nd Avenue to the county line. Sometimes we talk about it from east of 205, and then sometimes it's outside of Portland. And Portland, the city of Portland, is kind of the boundary where East County starts. So I'm just curious, as you were putting together these numbers and looking at programs and investments, what definition you were using.
Thank you, Commissioner. We're primarily talking about anything east of 205. And part of what we intentionally did was look for the programs that are further out East County, what is serving, again, Wood Village, Troutdale, those sorts of spaces that we know there isn't the same level of investments historically over time.
Yeah, and I would just add, I think when I was highlighting some of the programs, because there are many programs within those bucket categories, it's highlighting outside of the typical areas we may think. So especially in relation to the outreach and navigation, those areas that are unincorporated outside of, where Fairview and Troutdale are too. And so wanting to highlight areas that people don't always know about as far as services that are provided, because we have programs that are located in East County, like their buildings and such, but then how do the services branch out from there? And really trying to highlight those pieces as well, because I think those are the ones that we don't always get to see.
Yeah. Okay. No, that's
Yeah.
great, and I appreciate knowing the kind of lens that you're looking at all the different investments in. So I'm interested in the analysis that you're doing this fiscal year about the distribution of services in Multnomah County, and I'm just curious if you go into a little more detail about what specifically you're going to be looking at in that analysis, and like what information you're going to be trying to pull out of that.
Josh, do you want to speak a little bit more of some of the details that Yesenia shared? And we can also send some more out. Our SHS manager, Yesenia, is leading that work and was not able to join us this morning.
Yeah, so I think I would not want to speak out of turn, so I think it would be good for Yesenia to be able to get back to you on some of that. But in terms of the analysis around and in terms of like our overview approach to sort of understanding our distribution of services, I think we want to understand both what is located in East County, and then also to an earlier point, everything that we fund as a department is supposed to go across the entire county. So we want to see if folks are accessing services as well that maybe are located in East County, but are accessing services in other parts of the region. So that'll be part of this analysis, but I can get you more specifics later, Commissioner Peterson.
That would be really, that would be great. Yeah, I think that's just to know like what we're really looking at and what we're trying to do. I mean, I do think that having that kind of analysis, looking at how then we're distributing all the different resources. And I hope, I appreciated Commissioner Jayapal's question because it is, the fact that the $2.6 million is a very like discrete, set of investments that we're making, but they're obviously through different funding sources, different agencies, there's more of these dollars. Understanding, I think, how all the inclusive investments are really, are also being brought to bear on the different geographic regions or how we're distributing services is going to be a really important part of the work that we have ahead of us. So I'm glad to hear that this is happening. I think the last question is, and maybe it was like somewhere in these numbers, but this might have been something that is, wasn't part of the dollars that you put forward. I remember when we did a year ago, really, we did the fall bump and there was $3 million for a service center in East County. Was that included in the numbers here? And can you talk a little bit about that investment and the way that, how outreach and kind of the work with the different East County cities has been done around that investment?
I just wrote that down to say, see, mind meld. And I really am sorry that Commissioner Stegman is not here to talk about this. I know she's been heavily involved. But if you could talk about where we are with the service center, East County Service Center. Shannon.
Thank you, Chair. And thank you for the question, Commissioner. So the East County Service Center, we are in a due diligence phase on a property that we've been discussing with our East County partners. It would be a combination of, or the vision is for it to be a combination of a service center, potentially some shared office space, but also a shelter facility. So it would hold congregate shelter. There is potential for some alternative shelter in the site that we're currently exploring. Absolutely happy to share more when we're not in the middle of a real estate transaction so that we can, once we secure the building and actually can start programming and bring back some more details then.
And Commissioner Stegman has been involved in the outreach with all of the East County cities have been participating in that, and also members of the East County community. So I'm sure she would, if she was here, she would give you a lot more detail, and happy to have her send some more information about that.
No, that's great. I just didn't want to leave out that investment that was also happening. So yeah, those are all my questions. Thank you.
Thank you. Appreciate that. I know there's some follow-up that commissioners had, but just as we're thinking about our East County investments, I would be remiss if I didn't highlight, we have been investing in East County since the beginning of my tenure at Multnomah County through outreach efforts and contracts with Join and others, direct payments to the city of Gresham and others who were able to stand up some service provisions. I do think that the supportive services measure has really allowed us to expand our services there. And this also is interesting as we're looking at our relationship with the City of Portland through the Joint Office. We always have had East County representation, but it's been a little, interesting because of the amount of funding that the City of Portland has put in. And I do think that this kind of highlights how the joint office is more than just a joint office with the City of Portland. It's a joint office with all of the cities in our community, in our county. So thank you so much. Next up, we have an informational briefing to address an FY22 budget note, and this is the MCSO TriMet implementation planning for a transit crisis response team. I know we've had some briefings on this before, but we have updated news to share. I want to thank everyone for all of your work, and come on down. Good morning.
Good morning. Good morning, Chair Kafori and County Commissioners. For the record, I am James Erickson, the Chief Deputy of the Law Enforcement Division for the Sheriff's Office, and I am pleased to be here today. Joining me for today's briefing is my colleague, Captain Brent Lejeune, and County Health Department and TriMet leaders. Next slide. At the Multnomah County Sheriff's Office, it is our mission to support all community members through exemplary public safety service and to create a safe and thriving community for everyone. To reach these goals, we are committed to developing creative programs and identifying alternatives to traditional public safety approaches. Our partnership with TriMet and the County Health Department provides a unique opportunity to address some of the root causes of criminal activity by focusing on outreach, prevention, and service interventions. Today's briefing is a follow-up on our budget note on the work towards the implementation of a transit crisis response program. Next slide. This will depict a quick timeline for you. This is a timeline of the Multnomah County Sheriff's Office and TriMet's process in creating our contract. As part of our approval of the IGA, the Board of County Commissioners included a budget note and requested for MCSO and TriMet to partner with Multnomah County Public Health Department to create a behavioral crisis response model. We have been working together to evaluate and develop the framework to implement such a model. At this time, I would like to welcome Multnomah County Health Director Ebony Clark to share more information about this new role.
Good morning. My name is Ebony Clark, and I'm the Health Department Director, and my pronouns are she, her, hers. Next slide. And so what I'm just going to highlight briefly today is, the opportunity that we were able to step in as the health department in partnering with TriMet to leverage our expertise specific to behavioral health crisis and to also center our recommendations in our role as a local mental health authority. And so through that end, we had the opportunity to partner and build relationship and then begin to start to support TriMet and starting to explore models of how do we improve ridership for those that use public transportation, in addition to looking at a model that really responds in real time to offer supports and services to those that may be in a behavioral health crisis. And so through our process, we were also able to leverage the relationships that we have with the Joint Office of Homelessness, in addition to our Tri-County Health Department partners. And because of our commitment specific to equity and more specific racial equity, we were able to center our work in our values of eliminating structural racism. And through that process, we were able to partner and collaborate and bring forth the voice and perspective from the REACH program, from our Behavioral Health Office of Consumer Engagement unit, in addition to various peer advisory groups, to really make sure that we were mindful of bringing forward and recognizing and considering the disparities, to continue to assure that we are doing our due diligence around amplifying the voice, and really working to bring a public health approach that's rooted in a community and consumer-driven response. In addition to not losing sight of the importance specific to the Black, Indigenous, and other communities of color, as well as the LGBTQ plus communities, and how we need to be mindful in terms of strategy there. And so just wanted to highlight just some core areas that centered our efforts. And so I'm going to hand it to Leah Drebin, who will talk about how things came to light, talk a little bit more about our collaboration, and then bring forward the results.
Thank you, Ebony.
Good morning.
Chair, Commissioners. It's a pleasure to be here with you all today. As Ebony mentioned, I'm Leah Drebin. I use she, her pronouns, and I'm a Public Health, Behavioral Health, Reimagined Community Coordinator for the Health Department. It's a mouthful. I'm excited to provide this update to you all and share the phases of program development that led to evidence-based recommendations from the Health Department. And evidence-based practices are the integration of clinical expertise, consumer values, and the best research available. We were able to identify those practices through research, an environmental scan, and stakeholder engagement, which included TriMet system and reimagined background research, one-on-ones with TriMet staff and attending security, transit police, and Reimagine Public Safety Advisory Committee meetings, introducing the work for feedback to the Reimagine Public Safety Advisory Committee, the Transit Equity Advisory Committee, and the Reimagine Public Safety Advisory Committee, as well as TriMet's employee town hall. Ride-alongs with all of the safety and security teams and transit police, and data analysis through coordination with MCSO, working with safety and security's data analysts to begin tracking incidents that are potentially behavioral health related on the system. Observing related training that safety and security teams are receiving, and researching what other transit systems are doing nationally. And with that, researching best practices with our local transit and community needs and capabilities was crucial, because the Substance Abuse and Mental Health Association and others have stressed the importance of building programs that are tailored to the specific community. That's why we engaged and learned from over 225 local service providers, outreach teams, and community members with lived experiences in the program's development. With that, I'm grateful to our county partners, Clackamas County and Washington County, for sharing their behavioral health and outreach expertise and inviting me into the spaces that they've cultivated for peers. In doing so, we were able to learn from Clackamas County's Peer Advisory Group and Mental Health and Addiction Council, as well as Washington County's Peer Collaborative, which is led by the Mental Health and Addiction Association of Oregon, who have also been great partners in this work. In addition, we were able to learn from our behavioral health divisions, Behavioral Health Advisory Council, and the City of Portland's Committee for Community Engaged Policing Behavioral Health Subcommittee, NAMI of Multnomah, NARA, and as Ebony mentioned, the Joint Office of Homelessness, as well as numerous outreach teams in the Tri-County region, such as Home Plate Youth Services, 4D Recovery, JOIN, Central City Concern, Portland Street Medicine, Portland Police Bureau's Behavioral Health Unit, MCSO's HOPE Team, and crisis response providers, such as Project Respond and Portland Street Response. We also did not need to repeat the research that had recently been completed or was currently in progress. That's why I worked closely with the Office of Consumer Engagement to learn from their research, and learn from the county's racial and ethnic approaches to community health team and the research and engagement they have done around transit and with Black, African, and African immigrant and refugee communities, as well as partnering with Beacon, the Behavioral Health Emergency Coordination Network, to learn from their peer advisory work group. There were also monthly collaboration meetings and 2 whiteboard sessions between TriMet and the Health Department. It was in the first whiteboard session that TriMet's Executive Director of Safety and Security defined what TriMet's needs were, and gave an example of a successful partnership outcome with Behavioral Health's Forensic Diversion Team when a case manager provided an extensive amount of follow-up and skills training with a person who had frequent contacts with safety and security. And TriMet defined their need by sharing that they were not looking for a responsive crisis intervention team model, but instead a service outreach referral team model to connect and reconnect people to services. TriMet also sent me a specific example of what they were looking for and shared a link to St. Louis Metro's Behavioral Health Pilot Program. The program is a partnership between the transit agency and the local healthcare provider that has behavioral health specialists assigned exclusively at high-volume transit centers. Why is this important? This can offer prevention and early intervention strategies, which is a step towards ensuring a person in our community does not have to be experiencing an acute level of crisis when first responders and crisis intervention teams are needed to be called in order to access care and support. We have the opportunity to intervene at a more chronic form of crisis, for example, when people are seeking shelter on the system due to unmet basic needs, and work to prevent acute crises from happening. When we have to wait for a person to meet a high acute threshold, it's more costly. We miss opportunities to connect with people when we wait, when they need more costly first responder and high acuity provider services, which in turn likely requires longer time in treatment, but the cost is even greater. There's been an increase in stranger-to-stranger violence due to mental health crises and drug involvement. This has become an escalating safety issue. Therefore, we see this program contributing to the safety of all and maintaining safety through prevention and intervention strategies. With that, additional opportunities to better support TriMet staff and riders emerged from conducting a needs assessment. Emerging themes from engagement with people with lived experiences, service providers, and TriMet were compared to the missing support pieces on the transit system. The results are the foundation of the Health Department's program recommendations and led to the development of a recommended program logic model and draft outcome framework that was vetted with TriMet's Executive Director of Safety and Security. In collaborating together, we have identified data-driven, evidence-based staffing, touch points, and services to help communities maintain access to a crucial social determinant of health. And now I would like to share the core learnings from the research and engagement that serve as the health department's recommendations for the program. Next slide, please. The first recommendation is for the team to be a non-police, security, or uniform team. That means the team can have branded street transit outreach team attire, just not anything that resembles law enforcement, code enforcement, or security. The recommendation is for the team to follow best practices in outreach by wearing street clothing attire with no display of power dynamics to help individuals feel comfortable and safe. This was stressed by local service and outreach providers and by people with lived experiences, but there's also evidence to support this from research conducted with national transit systems. LA Metro has found that people experiencing homelessness are much more likely to accept help from non-law enforcement employees. Sacramento's Regional Transit District Police has found a higher success rate with trained outreach professionals making contacts without police. And clinicians on Denver's Regional Transportation District found they had more engagement when police stopped riding with them, which was attributed to the people feeling safer to contact clinicians when police were not present. As someone who was a former police officer, I can attest that uniforms are a barrier to connection for a variety of reasons. It is also something I personally observed during every ride-along with safety and security teams on the system. Uniforms can be a barrier because of what they represent, because of what one has experienced from somebody in uniform, because of what they have heard others experience, because of what they've seen in the media, because somebody did not pay fare, because of an individual's immigration status, or also something else I've experienced because somebody has a warrant. We do not want any of these reasons to be a barrier for someone in need of help. We want to ensure that every rider on the system has someone that they feel safe approaching for help. Lastly, having a team in street attire instead of uniforms is a trauma-informed practice. This is why the vast majority of outreach teams in our Tri-County region do not wear uniforms. Also, the majority of outreach teams, including some acute crisis response teams, such as Project Respond and Portland Street Response, do not have law enforcement or security as a part of the team. It appears to be a safer practice for these teams to operate without law enforcement or security present, as Eugene's CAHOOTS model has highlighted. Again, as a former officer with a background in sociology, I can share some of why this is. Law enforcement or security presence alone can sometimes escalate a situation. But also, law enforcement and security are trained and socialized very differently from behavioral health and addiction specialists because the scope and the role is very different. Ultimately, this recommended practice is a safer alternative for everyone on the system. It's safer for all riders, including the individual we want to serve, and safer for transit police and TriMet safety and security teams by only involving them when necessary and not unnecessarily placing them at risk. To sum it up, I'll share a quote from a woman with lived experiences who I spoke with at one of MCSO's Hope Team's outreach events in Troutdale, who stressed the need for this team to be out of uniform and not include law enforcement or security by adding, "If the person feels safe, you'll be safe." And with that, I'll turn it over to the Behavioral Health Division's Senior Manager, Krista Jones, to share why we are centering trauma-informed practices and how it can look on the system. Thank you.
Thank you. Morning, Krista.
Good morning. Thank you, Leah. I'm Krista Jones. I use she, her, hers, and I'm the Senior Manager of the Community Mental Health Program within the Behavioral Health Division. With this recommended model, we are centering equity and trauma-informed practices because we want individuals with mental health and addiction challenges to be able to maintain access to the public transportation system and for the experience to be improved for all. We are providing this recommendation based on what we learned of the need, but also due to our experience in the work and based on community feedback that we've received. We learned of a need for a response to the challenges that includes mental health and addiction specialists to connect with and support riders and safety and security teams. A need for an outreach team with resource knowledge and relationships that can connect and reconnect riders to services. A need for a trauma-informed team that can follow up with riders, provide skills training, and coach people with behavioral health challenges on how to ride the system. Finally, we have heard transit police advocate for increasing safety while reducing law enforcement's involvement with individuals experiencing these challenges. We know that to effectively address these needs, we have to have a program focused on prevention and early intervention. On the next slide, I'm going to share a little bit about the recommendations of staffing positions that promote these values. Next slide, please. We are also mindful of best practices to connect with vulnerable community members, and mindful of the elements that impact safety for all riders and TriMet staff. We highlighted values in our recommendations, including consistency, safer practices, and non-judgmental community engagement. We recommend creating a program that is peer-driven with clinical supports being available as an effective, evidence-based practice for this program. This is an upstream approach to intervene on an individual and community basis before the crisis even happens, while still creating supports and opportunities to address the acute situations. Again, these elements are evidence-based, which is what led to the peer-driven model for the Behavioral Health Resource Center and also the Old Town InReach program. In addition, Denver Regional Transportation District Police Chief informed Leah that he found that there was less need for crisis response services due to the proactive work of behavioral health professionals on Denver's transit system. Now I'll briefly explain the staffing roles and the functions. Peer specialists are individuals with experiential behavioral health knowledge who are in recovery and who have specific certification to perform specific duties. They provide non-judgmental listening, mentoring, advocacy, and provide a space for others to talk through their recovery, to share ideas, and also to build trust. They also provide navigation to the behavioral health system. We also recommend qualified mental health professionals, or QMHPs, to serve as an adjunct to the team. They provide risk screening, brief crisis intervention, and intensive case management. The intent is not to have the QMHPs replace crisis response teams, but rather to supplement them with a focus on early intervention. The recommended positions can provide TriMet and Transit Police with a team that has behavioral health and addiction knowledge, training, certification, and pathways to resources. Follow-up services are also an important element and feature of this program. Follow-up services will include both peer specialists and clinicians providing case management, referrals, skill training, and system navigation training. And lastly, we recommend the team be on the system and at dedicated transit centers for relationship building and a resource connection point for TriMet safety and security teams and riders. Having teams staffed at dedicated platforms where the data consistently shows needs, such as the Gateway Transit Center, provides prevention and early intervention strategies lifting up key values. The first value is consistency. We think it is important that outreach providers go to the same locations at the same times each week to build relationships with communities and provide people with a time and location where they can expect to receive that support. We identify that TriMet Transit Centers offer this connection space for both riders and safety and security teams. The next value is safer practices. Approaching people in an outdoor environment at a transit center instead of inside the MAX or buses follows tactical safety and risk management best practices. We know that approaching people in confined spaces can increase their anxiety and behavior unpredictability. So we identify the intervening and connecting at a transit center itself as safer for all riders, operators, safety and security teams, and program staff. In these cases, people are free to leave the area or the interaction, which can reduce the tension of the moment. Now I'll turn it over to Captain Brent Lejeune to share how the recommendations support MCSO and Transit Police. Thank you. Next slide, please.
Thank you, Krista. Good morning, Chair Kafori, Commissioners. My name is Brent Lejeune. I'm a captain with the Multnomah County Sheriff's Office, currently signed as the Chief of the Transit Police Division. The Multnomah County Sheriff's Office is committed to providing quality prevention, intervention, and rehabilitation services to the communities of Multnomah County. We seek to improve the quality of life by reducing crime through innovation, partnerships, and teamwork with the communities we serve. In addition to our current partnerships with the Multnomah County Sheriff's Office Homeless Outreach and Programs Engagement Team and TriMet Safety Response Team, our hope is that in following the Health Department's recommendations, we will have long-term positive impacts for Transit Police and the community by reducing police involvement with people experiencing behavioral health, addiction, and housing challenges. This will in turn help provide riders with appropriate support services and reduce the strain on Transit Police staffing to free up our services for criminal cases and conducting thorough investigations and provide more time for sustainable staffing practices. Next slide, please. The Multnomah County Sheriff's Office Homeless Outreach and Programs Engagement Team is an outreach first group. They connect community members experiencing houselessness with resources while also providing law enforcement services. Since NCSO provides police services to the transit system, this was an opportunity to provide outreach services to houseless community members while also having a positive impact for transit riders. The safety response team works closely with both the HOPE team and Transit Police, connecting riders in need to community-based resources in the areas of houselessness, addiction, and those experiencing mental health. Next slide, please. With that, I will turn it over to Andrew Wilson, TriMet's Executive Director of Safety and Security, to provide an update on where they are in the implementation process, as well as additional information on TriMet's Safety Response Team.
Yeah, thanks, Brent. I just want to say thank you to Chair Kafuri and the commissioners. Great to be here with you. One thing I want you to walk away with today is that we have some really great partnerships happening between TriMet and Multnomah County, both in the Sheriff's Office and on the behavioral health side. So a lot of good things to share. And I just want to say a special thanks to Leah Drebin, who has done a Herculean amount of work related to, you were reading through that list, but there's a lot of partners that she's engaged in on TriMet and on Multnomah County's behalf, and really strengthening partnerships and connectivity in our region. So huge thanks to Leah and everybody else at the Multnomah County Health Department. One of the things that TriMet has been going through recently, and I think you guys are aware of this, but we have been going through a reimagining process, which has been underway for a couple years, and we've really come out with some really excellent recommendations from the community and from others in terms of how we can make our system safer and more approachable for all. This effort by Multnomah County Behavioral Health has very much been a part of that. Leah's work has been a part of that, and us understanding some of the needs that we have, and so we just really appreciate that. Kind of moving on from partnerships that we've developed, some of the enhanced training, again, part of Reimagine, but also informed by Leah's work. We're engaging in a lot more de-escalation technique, a lot more better informed ways to approach safety on our system. And that's been a great benefit to us. So just again, kudos to everybody with Multnomah County Behavioral Health. The program model that Leah put forward and the logic model, I think it's about a month ago now, we've been kind of looking at, and it's just really well done in terms of understanding the gap analysis that we currently have. A lot of the models that we have put forward to kind of engage with an unarmed presence on the safety security side and really approach mental health in a specific way, there's some gaps there. And so we're working through that with this program model, and we're excited about kind of working together to find better partnerships as we proceed. One of the things I'd like to share with you this morning as I kind of wrap up and hand off to Marissa Clark. Marissa, you may remember when we were here about 6 months ago in an initial public safety update, she's been really helping us steward the Reimagine Public Safety Initiative here at TriMet. And we have recently moved her into TriMet's first ever Vulnerable Communities Coordinator with TriMet to help us sink in with some of the resources that Leah and Marissa have identified in the community. So as I hand it over to her, it's with congratulations that she accepted that role last week. So, and I think Marissa's going to cover a little bit more about some of the things that we've been doing in terms of the Reimagine space at TriMet. Marissa.
Thank you so much, Andrew. I wanted to give you all an update on a team that we highlighted last time and that we've brought up a few times.
I'm sorry, would you just state your name again for the record?
Yes, my name is Marissa Clark. I use she, her pronouns. Thanks. Thank you. The Safety Response Team has now been in operation for a year this month. Currently, there are 46 members of the team, and we are projected to have 48 team members by the end of the year. On average, the team performs 500 welfare checks monthly, calls that traditionally would have been routed to law enforcement. This team increases our ability to proactively address low-level livability issues and the basic needs of our most vulnerable riders throughout the Tri-County area. Another element that I wanted to update you all on today is our effort to connect with transit agencies across the country that have similarly been working over the last 2 years to reimagine public safety and security on transit systems. In August, the group held an in-person workshop in Denver, Colorado. We shared effective approaches to supporting riders, data collection, and garnering larger regional support for our programming, and we continue to meet on a regular basis. Finally, in my new role, I will be working closely with the city and providers as the implementation of the Menlo Park Safe Rest Village is rolled out, which is expected, as we all probably heard at the last presentation, to open in the next few months. Now I will turn it back over to the Chief Deputy. Next slide, please.
I'd like to thank TriMet for their dedicated partnership to the success of Transit Police. I'd also like to thank the Health Department for joining us in this important work. I believe MCSO truly reflects the values of Multnomah County and will provide professional leadership for TriMet's public safety services. Thank you, and I'd like to offer this opportunity for questions.
Thank you all so much. Questions, comments from commissioners? Commissioner Jayapal, you are first.
Thank you, Chair. Thank you so much, everyone. Good to meet those of you who are in new roles, Andrew and Leah, I think. This was really thorough. I don't have a lot of questions. Leah, I so appreciated the thoroughness of your report, you describing the research and the thoughtfulness and how that got you to the program recommendations that you're making, and it all made complete sense to me. I guess, and I may have missed this somewhere in the presentation, my really only remaining question is, as I understand it, the team that you're describing isn't a crisis response team. It is a team that is, as you described, situated at MAC centers, providing kind of affirmative, preventive care and response, and not a team that would be present at the time of a crisis. However, I'm kind of loosely defining what a crisis is, but I think we all kind of we know it when we see it, feeling about it. Am I right about that?
I think you are, and Leah, I might ask you to come, or Krista. Yeah, but I'll start off and Leah alluded to this earlier, is really the need that we have most acutely is that preventative element, and really we have lots of contacts, as Leah alluded to, with folks that are not connected to good resources, and we want to try to offer everything we possibly can for those individuals. We have data that supports there's some folks out there that need this connectivity, and so how can we kind of translate that into a peer specialist who can actually go out and do this work? And I don't know if that's a...
Yeah, absolutely. And I think that the reality is that a crisis could happen, and a crisis can happen at any moment. And so by having a team there, peer support specialists, and the qualified mental health professionals, a build up to that would be strengthening relationships with our crisis system and ensuring that they are aware of that resource and that there is a strong connection with our mobile crisis provider and other crisis services who are on the ground every day doing that work, so they can kind of support, maintain that trust with the individual and help them to a better health outcome.
Great. Yep. So I think that's how I understood it, that there's obviously a continuum. This is pre-crisis response, but with connections to crisis response. Great. Thank you. That was the only question I had. Really appreciate it.
Commissioner Vega-Peterson?
Thank you, Chair. Thank you all. I like to thank people by name, but there were so many people who were participating in this, and you really can you can tell that in all of the work, and just again, the thoroughness, the thoughtfulness, and really the robust way that you took on this opportunity to really figure out what could be needed and how this helps the system that we have now to better serve people. I think the statistic about the safety response teams actually doing 500 welfare checks a month that otherwise would be law enforcement, I mean, that's a really incredible number, just in terms of I think the goal we have of reimagining what public safety looks like and how we respond. I don't really have any questions. I think one of the things I'm interested is continuing conversations with TriMet in looking at how this reimagining safety and really these investments are going to work over the long period in terms of where investments are happening and how that how it looks like. But I think the experience of the riders on the system, the staff, the bus drivers, all of this is really about the overall goal of safety, and again, getting people to use transit, on transit, feeling comfortable with transit, and serving those that use it. So thank you.
Thank you.
Commissioner Myron?
Thank you to all of you, again to Commissioner Stegman for budget note, and then James for the introduction. I have a couple of questions, and I'll just go through each of you and ask some of those. But Ebony, no questions. I just love your first slide where you do as you do and put all of the pieces together and connect dots. And this is so dot connecting this whole approach, and I love that. Leah, I love what can't see. Oh, there you are. Right. I just want to reiterate what my colleagues have said and I think what I've said to you in the past, but long ago, but just love the background you bring to this work, that diversity of perspective from the law enforcement and the social services angle. And I can't imagine anyone better suited to be doing the work that you're doing. So thank you. I have a question. Krista, you are awesome as well. But I do have a question for you. Talking about making again, connecting dots, but connecting two services, which is sort of a crucial aspect of this work. And, we hear about the desperate need for more services in the community for people to connect with. Does this program envision increasing capacity or a different sort of place people might be referred to, or is it going to connect as we can in the services that we have?
Certainly connecting with the certain services that we have. I think at the moment that is the vision. And as we are kind of building programs across the community, what we're focused on is ensuring that a person has a warm connection right now. Even if that means that the longer term resource is not yet available, having that relationship, building that trust so that when that relationship is available, it makes the pathway just easier for the individual. And so that's really what we're aiming for with this program and this model.
Awesome.
Thank you.
Great. Perfect. And I don't know where Brent went, but also who spoke to, you all dispersed.
Big team.
But speaking to that intervention, prevention, innovation, all the missions are really, and reduction of law enforcement response need, ideally. And so I don't have a specific question. I just appreciate that and putting those pieces together. And it ties into Commissioner Jayapal, what you raised, that, and I was thinking about this too as you're talking about this work, all of you, that it's not exactly crisis response. I mean, it's intervention, pre-crisis, prevention. And I don't know if that we have an official name for the team or for the work being done, but maybe switching it away from crisis response team to reflect that really holistic work you're doing to engage with community with behavioral health needs. And so, Andrew, you just mentioned you wanted us to walk away with a sense of the great partnerships that exist, and I am definitely walking away with that sense, so thank you, mission accomplished. And Marissa, congratulations on your new role.
Thank you so much.
It's you're just in the right place. Two questions that I have sort of broadly. I don't know who the right person is, but could one of you speak to the impact of methamphetamine use on TriMet at all? Have you seen that, and is it impacting that work that you're doing?
I'll start, and Brent, if you or Deputy, if you want to add. So yeah, particularly fentanyl, but yeah, we have seen some impacts, and in fact, when there's a smoke substance on our system, we're actually delaying the train currently about 15 minutes to let it air out. So that is something that impacts service and impacts riders, it impacts everybody, but it's something we're doing to try to protect the health in the train. Obviously, there's no smoking allowed on TriMet at all, of any kind, any substance. So it makes it a little easier to sort of identify the opportunity to let it air out. But yeah, that's an impact, and I'd say impact from drug use and just other kind of, I want to say, kind of lawless behavior that's out there. And so one of the things that we've really tried to have here at TriMet is kind of a multi-pronged approach. And I think that's what you're seeing, right? Law enforcement should not be the first call on many of these incidences and don't necessarily need to be. And, we talk about connecting dots. The first dot would be a team that kind of centers in that preventative when they've identified someone that really needs services and needs help. Then you have a safety response team that can actually kind of address somebody's kind of acute basic needs. They have granola bars, they have water, they have just opportunities to kind of make a connection with person, but not do any enforcement activity, just really make connections. And then you have some more of our kind of more code enforcement teams, and then also ultimately sheriff's office. And so we're trying to kind of have a multi-pronged approach, which really helps keep things safe, but also kind of protect the most vulnerable in our system. So
That's perfect, and it actually segues into my second question, which is just around engagement with the sort of morass we have of behavioral health, sort of crisis response, outreach, all of those different services provided through different organizations, agencies, under different authorities, et cetera. And, I believe that our behavioral health team is exceptional at navigating that. I'm super glad they're there to work on that. I don't know if you could speak some to what that engagement looks like. That might be Krista or Ebony. I don't know.
Do you mind summarizing your question, please?
Yeah, no, not at all. Sort of how there are so many, in terms of behavioral health crisis response, outreach, dispatch, that, traverse the city, the county, law enforcement, BOEC, all of these different agencies, 5 different numbers for different crisis, different responses at this point. What does the engagement look like with all of those organizations and agencies to connect those dots, I guess?
Absolutely. The engagement is quite frequent. I facilitate a meeting monthly with EMS and with law enforcement and first responders. Barb Snow, our crisis manager in the Behavioral Health Division, also facilitates a quarterly crisis interface meeting. We have frequent collaboration and discussion across the crisis system. Last week, I presented a budget modification here to make the request for 4 additional FTE within the call center in recognition for that need for increased communication and collaboration. We also are partnering with Cascadia, Mobile Crisis Project Respond, to expand their services as well, to include more culturally specific services within the mobile crisis response. All of this is really, it's essential that we're talking frequently and sharing information as best as we can so that in the moment, the person who is in need doesn't experience a delay and also experiences that immediate care. You mentioned BOEC, and so I also want to note that one of the 4 positions that we proposed last week includes a staff member to be co-located at BOEC to be able to receive those calls more immediately, and then to be able to transfer to either Mobile Crisis Services, Portland Street Response, or to provide the general wonderful supports that the call center staff do every single day.
And I'll just add the why behind that is that we are the local mental health authority, and so our job, based on kind of what we've been mandated to do, is to be that connective tissue specific to behavioral health needs and more specifically crisis needs throughout the county.
I super appreciate that, and I know we have had many conversations about that very fact, and I'm so glad that we're reclaiming that and do want to mention that work with Commissioner Mapps' office to sort of put those pieces together on that sort of weird political level as well, because it needs to be all connected at all of those levels, and that's very promising as well. So thank you.
Thank you. Commissioner Jayapal had a follow-up question. Go ahead.
Yeah, just one quick follow-up. As I've been listening, I'm also thinking about the PATH program, and I'm curious about intersection, overlap, distinction between what this is setting up and what PATH does.
What I can say is that, PATH has through lines to our formal LEAD program. I know that there are upcoming conversations specific to kind of our current PATH work. I will say that we recognize that substance use is an area that we have to be mindful and intentional and strategic as we continue to explore effective strategies and solutions to meeting the needs of the community. And so that said, what I can say is that we can commit to making sure that we have PATH and just the lens specific to substance use response and treatment as we continue to build this out.
Thanks, Ebony. So if I'm hearing it, PATH, I think part of the answer was PATH has more of a specific substance use focus, and so
Correct.
Okay, and so this is broader, similar in the sense that it's early intervention, it's prevention, it's connecting people to services, but there's that slight difference in emphasis between the two. Yes. Okay. Thank you.
Thank you all for coming today, and I know you guys have done a ton of work. It's obvious and appreciated. I just wanted to remind folks that one of the reasons that this conversation started was because when the Board of County Commissioners voted to have the sheriff be the mothership, for lack of a better phrase, of the TriMet Transit Police, this was part of that commitment. And so I am curious about what are our next steps, because I think that going from concept to implementation is always is often where things get messed up. So I'd like to hear some more details about what comes next.
Thanks, Chair Kafuri. We're certainly in that process now, and it's really about kind of fitting in all the right pieces at that intervention stage in terms of the rest of the program. And I say that because, again, it comes back to this. We're trying to kind of reach everybody as much as we can. One of the things that I really appreciate about this particular program is that work occurs at our transit centers, where there's a lot of activity and a lot of opportunity for engagement. So we're working through that process right now. We haven't landed on how we're going to partner and who's going to be paying for what FTE and that sort of thing, but we're working through it. So.
Great, thank you. Appreciate it. Appreciate all the work you're doing. Thanks for coming this morning, and that seems to be it for our board briefing. So we will see you back here on Thursday morning at 9:30 for our regular board meeting.